Ask not what the NHS can do for you, but what you can do for the NHS. This appears to be the closest thing that the UK's empty suit, technocratic Prime Minister Keir Starmer has to an ideology. Just look at his latest miserable nanny states announcement. As of next October, junk food advertising on TV will be banned before the 9 PM watershed. Online adverts will also be banned entirely. The supposed aim here is to curb childhood obesity, but it's also part of Starmer's broader agenda to essentially protect the NHS from the public. This ad ban isn't an original idea of Starmer's, it's not entirely clear he's capable of those. It's been rattling around the quangos and activist groups for many years now. Both Boris Johnson and Rishi Sunak were signed up to it, but delayed its implementation. A reminder that whoever you vote for, the nanny state creeps always seem to get in. Still, it's fair to say that Labour is doing what it's told by the public health blob with a zeal the Tories lacked. Just look at all the puritanical, authoritarian measures this government has announced in its first few months in power. Top of the list is the generational smoking ban, also inherited from the last Tory government. This will mean the total prohibition of cigarettes, phased in over time, with the smoking age rising by 1 year every year until no one can legally buy tobacco ever again.
What is it? It is called a cigarette.
This policy is by turns illiberal, absurd, and insane. It's illiberal because the state should not be dictating what we can and can't do with our bodies, so long as we are not harming anyone else. It's absurd because in the not too distant future, it will mean 47-year-olds standing outside of off licenses begging 48-year-olds to buy them a pack of cigarettes. And it is insane because prohibition has been disastrous whenever it has been tried. America's 13-year experiment with alcohol prohibition led to an explosion in the black markets, organised crime and poisonings. The only nation that has tried smoking prohibition in the modern age is Bhutan. This began in 2004 but was abandoned in 2021 after smuggling flourished and smoking among kids actually went up. To give them their due, ISIS also banned smoking in their hellish caliphate. The punishment for smoking cigarettes was having your finger broken. The punishment for selling them was death. But let's not give Starmer any ideas here. Indeed, despite the rampant authoritarianism of this generational ban, it still doesn't go far enough for the Prime Minister, it seems. Last month, we learned he also intends to ban smoking in beer gardens and outdoor smoking areas, places where a lit cigarette is only really a danger to those around you if you're all standing in a puddle of petrol.
Really pleased to hear that we had longer term.
The war on smoking has never really been about protecting non-smokers from harm, and this latest petty policy demonstrates that perfectly. Starmer has tried to present the pub garden smoking ban and the crackdown on smoking more broadly as a way to protect the NHS, but the data are simply not on his side here. Indeed, numerous studies over the years have shown that smokers tend to cost the state less than non-smokers in terms of health and welfare costs, by dint of the fact they tend to die earlier. Here we see that the nanny state is not about protecting the common good, as is so often argued. It's about pushing people around. It's about imposing the tastes of the political class on the supposedly slovenly, uncouth lower orders.
I am smoking a fag.
This is why governments pursue these policies so fanatically, even in the absence of any proof that they will work. Just take Starmer's junk food advertising ban. While it will certainly hammer the advertising revenues of already struggling broadcasters, it's not as if children are going to suddenly forget that McDonald's exists. In the 2 years after Transport for London introduced its own junk food ad ban on tubes and buses in 2019, childhood obesity rose faster in London than the national average. There's also a tremendous amount of class prejudice here. Eating junk food, like smoking cigarettes, is seen as a nasty, ghastly habit that the poor and working classes must be re-educated out of. Interestingly, the fact that some Pret sandwiches are more calorific than a Big Mac, or that French cuisine is loaded with butter, never seems to figure in our debate about obesity. This healthy eating crusade isn't going to be limited to children either. These things never are. Starmer has also announced a new scheme of health MOTs, in which NHS staff will go into workplaces and weigh people, referring the more portly members of staff to NHS weight loss clinics. It's basically a system of state-sanctioned fat shaming. Starmer is trying to fold all of this into his tough decisions narrative, the idea that the Tories have so screwed the economy and the health service that desperate measures are required. Some of our changes won't be universally popular. We know that, he has said, but I will do the right thing for our NHS, our economy, and our children. The logic here is quietly sinister. Because of the dysfunctions and mismanagement of our healthcare system, ordinary people must have their choices curtailed. We must go without some of life's great pleasures. As the IEA's Christopher Snowdon has put it, Starmer is trying to reform the public, not the NHS. The New Statesman magazine has dubbed this the preventative state. It is key to Starmer's political worldview, apparently. He wants to be tough on the behaviours that supposedly put too much strain on public services. But as we know, this preventative state will not stop the NHS from collapsing. It will just make us all less free, while creating a bonanza for the black market. This unhinged nanny statism is one of the many things that Starmer has lifted wholesale from New Labour. The politics of lifestyle, as it's often called, was central to Tony Blair's governments, which combined a desire to depoliticise big economic questions with taking an unhealthy obsession with how we live our lives. This is why New Labour granted independence to the Bank of England, handing unelected bankers the power to set interest rates before banning smoking in every pub and club in the land. Technocratic politicians are drawn towards prohibitionism, in part because they lack any transformative economic vision for society. The irony here is that raising living standards is the most effective preventative public health measure by a country mile, because poverty is a cast iron predictor of poor health. Starmer's embrace of the nanny state, therefore, is a tacit admission that he doesn't know how to address the structural issues that face us, and so has resigned himself to berating us for what we smoke, eat, and drink. There have always been sections of bourgeois society repelled by the tastes of ordinary people and committed to foisting their puritanical values on everyone else. Now, after decades of public health encroachments on our liberties, the business of government has become completely bound up with this petty lifestyle snobbery. Keir Starmer's killjoy state is what happens when politicians cannot solve society's problems and so decide that you are the problem.